Hi everyone, this is Dr. Merhaut with Elite Sports and Spine Chiropractic. Welcome to this week's Elite Education series where we're going to be talking about sinus pressure and allergies and some things that we typically do in the office if someone comes in with sinus headaches, allergy type headaches, a lot of pressure, congestion, things like that. So there's different soft tissue techniques that we do, different sinus drainage massage techniques that we'll utilize. So I'm going to go over that and kind of demonstrate what we do for it. And we have Dr. Keklak here with us today that's going to be our patient. He said he does have a little bit of congestion going on today, but so we'll work on that a little bit. So to start things off, let's actually move this down. All right. To start things off, let's talk a little bit about the sinuses in general. We have a couple different sinuses that we'll typically work on, frontal sinus being one of them, so sometimes people have a lot of pressure within the front of their eyes or behind their eyes, things like that. So the frontal sinus is right around this area, as well as the maxillary sinus, which is down through this area. So some people feel that pressure underneath the eyes or across the nose. You have the ethmoid sinus as well, which is in there, and the sphenoid sinus, which is also kind of deep within the head. So sometimes it feels like a deeper type of congestion or deeper pressure. Sometimes it's the ethmoid or the sphenoid sinus. But all of them are located right around this area between the eyes and the nose and on the sides of that. So we're going to work on that today. So one of the first things that I typically will do is there's a notch right on the eyebrows where we'll basically just massage that notch. There's a nerve, it's a supraorbital notch with a supraorbital nerve that comes out of that area. So we will massage that area. That nerve comes from the trigeminal nerve. And the trigeminal nerve is a nerve that actually goes and stimulates and controls the mucous membranes of all the sinuses. So by stimulating the nerves within that area, it has an effect on helping with proper drainage of that sinus. So we'll do it to the frontal sinus up through here. We'll also go down and work our way to the maxillary sinus. There's also a notch down there which is the infraorbital notch. So the infraorbital nerve comes out through that way, which is also a nerve that comes from the trigeminal nerve. So we'll stimulate those. And then we'll do a little bit of the sinus drainage massage where we start on that notch and kind of drag out to the side on both sides as providing pressure in the same capacity on both sides. And we'll also do that down through the maxillary sinus. This also has the effect on the ethmoid and the sphenoid sinuses as we're going through this area by the nose. This will also help open up just the nasal passageways in general. And we'll kind of drag down from the frontal sinus past the sphenoid sinus and the maxillary sinus down this way. This is also where lymph channels are. So we'll have lymph nodes that we're affecting by going over these areas, stimulating proper lymph flow and lymph drainage. Lymph drains down towards the chest from the head, so we're promoting that flow as we go down. When we get down past the jawline, we want to make sure that when we're going down into the chest and the neck that we're only doing one side at a time, just because you do have the carotid artery, which if you kind of put pressure on that, there are receptors within that artery that have an effect on blood pressure. So if you're stimulating both sides at the same time, then the person can get lightheaded, potentially, even pass out if you're doing it at a significant amount of pressure on both sides at the same time. So that's why we're only doing one side at a time when we work down through this area. This is also where a lot of the lymph channels are. So we're working through those lymph channels, getting that to drain towards the chest. And then we would do that same thing on both sides. We also work underneath the chin and drag out laterally, another area where there's lymph channels. So we're again promoting that lymph drainage. And then once we get down there, we can even do almost like a pumping motion with the clavicles. So because everything lymph from the head drains down into the chest, we can do a pump motion with the clavicles where we just place the palms of our hands on the clavicle and then kind of rock back and forth over that area to promote the flow of that lymph fluid as well as just other fluids in general. So we can do that. Other things that we'll do is we will use an activator or a tool that will help break up some of the mucus within the sinuses. So we're literally just place the thumb over the area, put it on a really low setting, and kind of click right over the sinuses to help break up some of that fluid. And I'll do that on all the sinuses, and I would do that on both sides. As well as some suboccipital releases back through here, which oftentimes there's a lot of pressure in the back of the head from different sinus headaches, allergy headaches, different things like that. Sometimes it can be a tension headache within the area back here. Sometimes we'll see a couple different kinds of headaches at once. So we try to hit all of them within one treatment, so we're having the best effect and the best outcome. So with a little bit of suboccipital massage back through this area, and then if it's needed, we'll finish off with a little bit of cervical spine adjusting. So with Dr. Keglak today, he does have a little bit of restriction, so we'll basically just do a typical cervical spine adjustment that we do on any given day. I'll do a little bit on the other side. And then finish off just with a little bit of traction, manual traction, up through the neck, promote a little bit more relaxation and drainage of the lymph channels. So if you have anybody that typically gets sinus pressure, sinus headaches, if you yourself get sinus pressure and sinus headaches, allergies because you're outside this time of year cutting grass, all the pollen is really high this time of year, feel free to share this with those people. If you have any questions about anything that we do typically for sinuses or allergies and things like that, also feel free to comment or message us, and we'd be happy to answer those questions for you. But this is the Lead Education Series. I'm Dr. Merhaut here with Dr. Keglak. Hope you join us next week.